Good morning, everyone. I'm John from HTN, and welcome to this webinar today, where we're set to discuss digital leadership now and in the future. So over the course of the session, we will talk about how digital leadership has changed over recent years. We'll talk about the capabilities that make a great digital leader. We'll move on to talk about building digital confidence across an organization, as well as asking how to attract and retain digital talent. And we'll focus on leadership in line with the 10-year plan and how that may change. So we've got lots to get through over the next hour, and I'm looking forward to hearing from our panel and hearing about their views and experiences. And as well, I'm keen to hear from you in the audience. Please feel free to contribute anything in the chat. If you'd like to answer any of the questions that I'm asking to the panel today, we're keen to hear from you and hear your thoughts. As well, feel free to ask your own questions, type those into the chat, and we'll keep an eye on those as we go. And as always, if there's anything you'd like to share, any links, resources, your views, type them into the chat, and that'll be great. Just to mention, this session will be recorded and there will be a write-up done by the HTN team, so you can read or watch it back at a later date, and the write-up will cover some of the key discussion points. So let's get started. If I could start with some introductions, please. If our panel could take us through their role, remit and organisation, and kick us off with, what does digital leadership mean to you? So Penny, welcome to the webinar. Could I start with you first, please?
Thank you, John, and good morning, everybody. Thank you for inviting me. I'm Dr. Penny Kehayoglu. I'm a consultant clinical oncologist in the NHS by background and the Chief Clinical Information Officer for University Hospitals Coventry and Warwickshire. And for me, I'm very passionate about the subject of digital leadership. For me, it's the collection really of digital assets, starting from people, platform, which is the technology, and our processes, which together, basically, they aim to add value. If we talk about healthcare, for me, it's about improving outcomes for patients, for citizens, reducing costs, reducing inequalities, and generally adding value in terms of productivity. But I'm sure other value measures will be for other kind of industries.
Fantastic. Thank you, Penny. Great way to start. And Harry, could I come to you, please, for the same, an introduction, and what does digital leadership mean to you?
Yeah, brilliant. Thanks, John. And hi, everyone. I'm Harry, doctor by background, but I've been working in health technology for the last 11 years or so. Part-time, helped to support the NHS Clinical Entrepreneur Programme as a mentor, so coaching early stage entrepreneurs and NHS staff who want to be innovators. But my day job is working with AirLogic, where I'm the Director of Health and Innovation. And AirLogic is a health tech consultancy that builds lots of the big national systems for the NHS, things like the spine and the vaccination service, and also supports trusts at a local level. For me, I think good digital leadership is about servant leadership, really. So what does that mean in practice? I guess empowering and creating the space for people to be creative and ambitious, focusing, really laser focus on end users and solving real world problems, and then removing blockers, removing challenges out of people's way, and making sure that they're kind of bridging the gaps between organizations and between teams. I think those are the key facets for me.
Thank you, Harry. And Simon, could I come to you next, please?
Yeah, thanks all. So I'm Simon. I'm head of digital at Royal Papworth Hospital in Cambridgeshire. Prior to this world, I was working within digital agencies, but transcended into this world following a social innovation MSc at Cambridge Judge Business School. And then it was for me kind of, how can I use all of that digital leadership and skills I'd learned sort of working way through to the top in agency world to, support and help healthcare and health and care. Interestingly, I kind of split digital leadership into two. For me, it's how do we address, as leaders, how do we address digital? And then how do we address leadership as two kind of separate, but then conjoined functions? And I think then for digital, in my experiences, then we need to kind of look at unseen opportunities. I think it's always the approach I've taken is to how do you see things differently? How do we challenge groupthink? And when you start to look at maybe what happens in the NHS, how do we then embrace innovation, because sometimes we kind of step away from it. So as digital leaders, we need to embrace innovation, address it and own it, and not kind of run away from it or have our head in the sand and kind of just think it's not there and we'll come to it later. AI is a prominent one of that. So as leaders, then we need to be taking on board what everybody else has said. But it's, I suppose as leaders, it's making sure we kind of have a way of just going in the right direction, understanding what other people are looking for from us, whether it's our teams, our departments, our peers, and providing that trust, that integrity, and that credibility to drive forward and provide that lead forward as people look to us for that steer and direction. So yeah, it's bringing those two together. But I do see, as we may come onto it later, as digital leaders in this world, I think we just need to tackle a lot more and be open a lot more as leaders to thoughts. So yeah, it's Kickstarter for 10.
Great, thank you, Simon. And Kath, finally, welcome to the webinar. Can I come to you for a wider introduction, please?
Yeah, morning everyone. So I'm Kath Potts, I'm Chief Digital Officer at University Hospitals Plymouth, and currently leading the programme as site lead for our EPR implementation for UHP as part of the One Devon EPR. So I agree with everything everyone said. I think a few things for me, really, it's that bit about putting patients and staff at the forefront and understanding what they need. So digital is obviously an enabler to lots of the things around finance, productivity, resourcing, all of those things that are key to, you know, our leadership teams, our staff and our boards. So really making sure that, you know, what we're doing is kind of co-designed, and I guess that then leads to that bit about leading transformation and change. I think the digital role has become far more about that transformation, being a strategist, you know, helping deal with culture, thinking about innovation, all of those types of things. That's become much more prominent in the role, and alongside that, being agile and flexible, so working with our teams and also thinking about that kind of calculated risk taking about what we take on in terms of innovation and how fast we do that, and do you do that first? And I think as part of that, you know, really being okay to say, you know, something didn't work, or, you know, something might not have gone as well as it does, or being prepared to fail at something, because sometimes we need to say things haven't worked as well. So I think really pushing that transformation and strategy agenda and that change is sort of the biggest piece for me, I think, of digital leadership at the moment.
Fantastic. Great points there, Kath. Thank you for that. And could I stick with you for the next question, please, in terms of how has digital leadership changed over the past 5 years? And I think you've touched on it a bit there, but from maybe a leader's perspective in terms of skills and capabilities, how have perhaps those skills had to evolve or adapt over the past 5 years?
Yeah, so I mean, I've got a slightly odd background. I'm a clinician and an operational person by background rather than digital, and digital sort of new to me in the last few years in terms of my role. So I think for me, there's been a real shift in terms of something being very technically focused to actually digital being very clinically led. And very much at that forefront of that transformation innovation agenda. I'm sure, you know, it's the same across the country now. We're talking about how, you know, digital enables all of those things that we want to do to drive transformation, to drive productivity, to drive innovation across the board. And it's very much being that kind of support and lead, and enabling our colleagues to do that, and working hand in hand with frontline staff to say, actually, what is it that you need as a solution, rather than what the solution is? Because I think probably one of the things that's very different is we've got a huge market out there in terms of what we've got available to us, but it's not always the right answer. So it's looking actually and going back to really core principles of what is it that we need, what is it that we're trying to solve, rather than just jumping to a technical solution, and making sure that we're getting lots of that feedback, and kind of, you know, trying things along the way before we get to the right place.
Fantastic. Thank you, Kath. And Penny, could I ask you the same question, please, in terms of how leadership for you has changed, particularly in terms of skills?
Surely. For me, the important aspect of digital leadership at the moment, and that's going to evolve further, is being more strategic. We have always been quite reactive in terms of implementing innovation, technology. But we come to a point where resources are scarce and the cost is really high, and we want to add value out of each implementation. So I do think that digital leaders have become more strategic and there is room to improve. We've seen more chief digital information officers obviously having positions at board level, which I think is a really important aspect of driving top-down digital innovation and sponsoring digital innovation. And of course, ensuring that digital is actually part of the organizational strategy. I think that's critical. It cannot be seen as something separate. So apart from strategic skills, I think the important is the people skills. And as Catherine said, we are dealing with people when we are transforming, when we are innovating, and digital is no different. How do we ensure that we've got the right people skills to actually communicate the need for change, to bring people with us along the change, and to measure and evaluate the outcomes and the benefits, hopefully, at the end of it?
Fantastic. Thank you, Penny. Harry, could I come to you next, please? So Kath's spoken about Agile, and keen to hear your views on Agile and what good Agile looks like and what that can mean to an organization.
Yeah, brilliant. Thanks, John. And yeah, Agile, it's an interesting one, isn't it? Sometimes I think it gets a bit overused. I think sometimes people will do a stand-up or have a couple of Agile ceremonies and they say, oh, we're Agile, but they've actually lost what the kind of core meaning and what the principles are that sit behind it. I think good Agile is, it's something we're very passionate about. Logic, we're Agile first consultancy, and it's something that we helped NHS Digital and now NHS England really adopt. I think the core bit of it for me is what others have already mentioned, having that relentless focus on end users, like what are the actual problems you're solving for the people who are going to be using the technology, and then taking that kind of iterative approach to it. So identify where you can release the most value early, build that as a simple iteration, get feedback from your end users, and then bring that back into your development. I think there's and still is sometimes a tendency to try and map out absolutely everything that a solution could do. Whereas if you can be more agile in your approach, you can deliver in small increments, and then actually over time you end up going much more quickly. So yeah, I think there's a lot of benefits that can be got from agile, and it's something that we advocate really strongly in our work.
Fantastic. Thank you, Harry. And Simon, I'd like to hear your views on Agile or processes that you've introduced. And as well, you mentioned the question of how to embrace innovation as a question and as a leader or as an organization. How are you doing that at the Royal Papworth?
So we've got a piece, in answer to that last question first, but we've got a piece of work going on at the moment. We've just formed our 2031 strategy for the trust. So I sit as part of that, what the class is Team 2031, to then drive forward digital and the use of digital at the heart. Appreciating at Papworth, it's a kind of a leader in terms of clinical excellence and its specialism around heart and lung, and everything that sits around it. So it sits there both, as Penny was talking about at the top, at strategic, but actually what I'm now delivering, working with Director of Operations, Strategic Operations, that's kind of your background, Catherine, as you mentioned, to deliver digital and strategy, getting the basics right. So kind of then not just bottom up, but at the heart of all the different stages and levels. And kind of you talk about agile as well, that feeds into it. One thing that Kath mentioned earlier was co-design. And I kind of wrote it down, and then you spoke about Harry about agile. One thing that we should have more of, in my opinion, is user experience, user journey, which sits across both. It kind of gets spoken about, but we don't embed it enough, is really understanding that user journey, clinical, non-clinical, patients, etc. So I think innovation, we need to have more about not just our processes, but the people we engage and how we engage it. We're very kind of into project management focus, but waterfall, A to B, done, start to end, nothing in between. You need that innovation, that working through, that agile working. Doesn't always fit the NHS world, does it? So it's, and things that have happened over the last 5 years, that I think is driving that change is that it used to be organizations would have something digital and tech that would just fit. That's what Penny was mentioning earlier, wasn't it? Kind of, we'll have it, we'll place it in, and that'll solve everything. It doesn't. It's not going to, unless you understand the users. But what's changed over the last 5 years is that everybody has now become fluid in how we use digital and tech in our everyday lives. Generations are growing up with it. So it's less about people like me being a digital expert within a trust and organization in healthcare. But if you look at Harry, Catherine and Penny, their kind of background isn't digital, but yet they are subject matter experts in what they're doing. So actually it flips it round. As digital leaders, we need to find a way of embracing the expertise that others have out there and embed that through our user journey and user experiences. And I think without it, that's the challenge we face now. Without doing that and embracing that, not sticking head in the sand, as I said earlier, it's the only way we're going to move forward. But otherwise, we're going to find ourselves in a bit of trouble, if I'm honest, in terms of patient care ultimately, because we're not going to deliver.
Thanks, Simon. And Penny, could I come to you next in terms of embracing innovation, fostering a culture of innovation, and keen to hear your views, but as well, the question of what role does psychological safety play in digital innovation as a leader?
Yeah, it's a really good question. And having studied innovation at PhD level, I know it's a messy process. It's not a linear process, as many people think. I think it's important. The agility aspect is key because we know things will not work out always, and we need to be honest. And that's where psychological safety comes along. We need to be honest about what works and what doesn't work, and not being, I guess, afraid to say, okay, we piloted this, but actually it doesn't actually lead to any improvement in user experience. It doesn't improve our strategic goals. Continuing with the technology that actually does not offer any benefit, it leads to workforce burnout on top of other things that they need to do. So I think it's very important to appreciate that innovation comes in different shapes and forms, has different journeys. It is a journey, it is a process. And it's important that people are engaged in that process. We don't leave them behind. So that involves open conversation, that involves communication. Where we are, whether we need to delay a program, why we need to delay. People should not be surprised when we are transforming that, this is happening. They should be part of it, that decision making. But also on the other hand, if something is working, there is tremendous knowledge in the NHS currently. We know what has worked. We have scaled what has worked in other systems. We need to spread that knowledge. Okay, so it works both ways, psychological safety, and it is imperative if we innovate safely. And innovation brings failure. So accepting the failure and moving fast, learning from it to actually move into improvement. That's where psychological safety has the major value.
Fantastic. Great points, Penny. Thank you. Simon, would you like to come in?
Yeah, well, quick question, quick open one really. So when do we within the NHS do the kind of the innovation, the psychological safety, and go down that pathway versus internally, versus when do we start then embracing kind of external kind of consultancies, agencies, suppliers, tech innovators, whatever they may be, to then solve the problem? It's an open question really, and I don't think the NHS has kind of answered it. It wants to do something in-house and allow that psychological safety to innovate, but actually, can we then deliver on it? Do we have the resource to deliver on it? So how far does that get us versus do we innovate? And then when you've got external organizations, consultancies, whatever, companies innovating, do they have the knowledge and expertise that Penny's just referencing themselves to then solve the problems? It's an open question. I've got my thoughts, but yeah, keen to hear others actually.
Harry, do you want to come in for that one?
Yeah, I had my hand up to pick up on something on what Penny was saying, but happy to come back on this. Although, of course, I'm slightly biased working for one of those external
Sorry,
agencies.
that wasn't teed up, John. By the way, that wasn't teed up. It's just.
But very happy to share a thought, which is from our perspective, we don't really want to be seen as something external and something which is siloed and far removed from the NHS. I think where our projects work best is where we work in a properly blended team. So yeah, we've got people with excellent technical expertise, but obviously NHS organisations have people with that frontline clinical knowledge, deep understanding of the organisation, and where really successful projects happen is where you can mesh those two together in a properly blended team, and you kind of take advantage of both. And the other thing is to then to make sure that those two teams are upskilling each other, so that you're leaving those skills behind within the NHS kind of resident team, and then also for us, we keep on trying to build that understanding of what's actually going on the ground. I did have one other point I was going to make, but I don't know if we want to come to Kath first, John, if she wants to come in on that.
Sure, and then we'll come back to you, Harry. Yeah, Kath, do you
yeah, just a reflection and thinking about what Penny was saying. I think we've got a lot to learn from some of the, big tech firms that have done things at scale. And if we think about, what's been done over time, and now you buy a handheld device and there's no instructions and you just go home and everyone automatically knows what to do, don't they? So there's something about that bit about the end user and viewing our end user as a customer, and a bit to what you were saying, Harry, with our teams, it's actually about kind of flipping that focus, isn't it? And thinking about, when we're trying to innovate, it's the customer at the end, and would they kind of recommend, what you're doing to somebody else at the end of that process, and does it fit what they want? And, and then from there, is it scalable? And, we've all then got good opportunities, I think, in that to kind of share that learning and do that scale across the NHS in a much better way than we currently do.
Thank you, Kath. Harry?
Yeah. Well, so I just wanted to just very briefly go back to the psychological safety question, because I think it's just a fascinating topic. And one of the things that I've been reflecting on, we try to operate as a low hierarchy organization. And I think we see a lot of benefits from that. Everyone's got voice, everyone's prepared to speak up, whether that's the most, junior developer through to, really experienced, technical architects or whatever it is. But we often then work with public sector organizations like the NHS, who can be much more hierarchical, and there's quite often an interesting interplay between those two things. And I think with hierarchy, maybe sometimes can come jeopardizing psychological safety. So I was interested to get the rest of the panel's thoughts on, how you view hierarchy in that context. Do you think we should try and flatten it? And any sort of practical advice on that? I'd be fascinated to hear your reflections.
Great question. Thank you, Harry. Penny, would you like to take that first?
It's a really good question, and actually that is the culture that we want to drive. That not the hierarchical bit, that the middle management, for example, and there are roles that fall into that space. Okay, the CXIOs, the CCIOs, they fall into the middle management, I would say, and they have a huge role to play in bridging that gap. And for me, they are certainly the voice of the front line, and that voice is extremely important. We know that only over the last few years, we have seen clinical safety officers, for example, and actually having those structures where we can discuss clinical safety in digital, what's safe, what's not safe, and that experience from the front line is important, that is transmitted upwards and there is open conversation. So I don't think there is practically any space for hierarchy here. This is about patients in healthcare at the end of the day. This is about adding value, and therefore we all need to talk the same language and support each other in making the right decisions. And I think the decision making is extremely important, and we should not undermine the knowledge that the frontline has from their experience and from the contact with their patients and their experience too.
Great points. Thank you, Penny. Kath, would you like to come in? Is there anything that you want to add before we move on?
Yeah, I mean, I agree. I think probably less to do with hierarchy in the NHS. I don't think we're ever going to sort of flatten that hierarchy completely in an NHS structure. but there's that piece around actually how is that managed and how are people given that space, and I think it's about building trust with leaders at every level of the organisation, and I think the thing for me is that actually a leader isn't about the hierarchy and your post or your title or your band or whatever, however we do it in the NHS. Actually, a leader is about how you're seen by the group of people that you work with. So, we get back to that old debate, don't we? A manager versus a leader. We've got a very hierarchical management structure in the NHS, but actually as a leadership structure, I think, that needs to be viewed very differently about who is a leader in an organisation and how they work with their teams, and what that looks like.
Great point. Thanks, Kath. Simon, is there anything that you would like to add?
No, probably not massively on that. I think it's probably open citizens, non-hierarchy person. I see you got a question. I'll let you dive into that one, John.
Great. Well, I wanted to move on to the direction of the 10-year plan and how digital leadership might need to change and evolve in line with the direction and the vision that's set within that. And I think that's an interesting question to move on to. Penny, could I start with you, please, and to hear your views?
Surely. Clearly, digital is all over the 10-year plan, isn't it? In all three dimensions. I mean, if we take the community aspect, which I think is where things are actually moving and changing over the years, is that we need to move from hospital to community, and that will bring the sustainability of our services. So that brings a lot of digital interoperability, a lot of infrastructure change, and of course with that, workforce change and the way we are operating. So we are already seeing the impact and the talks around neighborhood health. There are activities happening around treating patients in the community when they don't need to be in a hospital. And digital will be the biggest enabler in doing this. And of course, to make this successful, the data connectivity, the decision making, the way we operate between hospitals and community needs to change. So for digital leadership, what does that mean? It means that we need more system leadership, and different skill set that brings the silo teams a bit more outward facing, I would say, and looking at the bigger picture, more of a system-wide approach to leadership rather than a silo looking at the department. So for me, I would say, community and the movement to community is the biggest thing for digital. And of course, that brings the prevention element, the digital health element with it.
Fantastic. Thank you, Penny. Kath, could I come to you? Keen to hear from how this is happening in Plymouth and Devon, and how it looks like in terms of leadership in line with the direction in the 10-year plan.
Yeah, so I mean, I think taking the 10-year plan, as Penny said, there's a huge focus on digital that's sat in there. And I think that, part of the leadership in the space is going to be thinking about how we do things more efficiently and do things once. So it's thinking about doing things, safely and, potentially small scale, but how we scale up quickly and how we do that much more across geographical locations, across multiple places, across not just the acutes, but potentially our community providers and primary care and all of those sorts of things. So how actually we become much more joined up in terms of how we do things. We know that we get much better, economies of scale in terms of doing that. We know that we, have much better leverage in terms of working to get the best deals on how we can do that if we do that across more than one place. So I think for me, the leadership in that space is much more strategic again. So it's coming into how do we do this across much more than a single sovereign trust in the NHS, but how do we do this across geography and maybe across geographical boundaries even further than that as well, from where we currently sit. And I think there's a real opportunity in that, with obviously the changes across ICB boundaries and how we're working across organisations differently, and the digital blueprint coming forward. But I think wider than that, It's about how we as leaders reach out to each other. So actually, if Penny and Simon are already doing something, actually they do it, then we scale it across the rest rather than all of us trying to do it at the same time and try to get that in place. So how do we work much more collectively together as a group of leaders across, you know, the NHS and wider organisations as well, and digital?
Fantastic. Thank you, Kath. Harry, would you like to come in? I'm keen to hear your perspective.
Yeah, happy to. And I think there's been some really great points already made. I guess maybe to slightly reiterate them and potentially to be a little bit contentious. I like to be a little bit contentious now and again. I think I really agree with what Penny was saying. Digital is got to be a huge part of the 10-year plan, and it's the only way that we kind of deliver some of those outcomes. I think out of the 3 shifts, actually, some of the more interesting bits are in the shift to community and in the shift to prevention, particularly in the shift to community. I mean, from my perspective and having interacted with quite a lot of different ICBs around the country, I think there's a real need there for good, strong leaders to bridge those gaps between organisations. I don't think I'm speaking too out of turn when I say in some ICBs, I think there's a bit of an unbalanced power structure, and maybe the acutes in some areas have a slightly louder voice than maybe some of the community providers. And so what I think we probably need is really good, strong leaders who can put aside their organizational loyalties and think more about how does the ICB win as a whole, and ultimately how does the patient who lives in that ICB win as a whole. And that may mean some uncomfortable trade-offs, right? That may mean that there's less funding coming to one part of the ICB and more money going to another thing, and that might actually damage your host organization. But it's about being brave, and it's about being able to see that kind of bigger picture and to make, you know, decisions and in those trade-offs. And then the other bit, I think, something that I'm really passionate about is the shift to prevention. You know, I think we keep on our current trajectory. I read a paper that said globally we're going to be spending $47 trillion a year on chronic diseases if we don't do anything by the middle of the next decade. That's obviously unsustainable. So prevention has got to be at the heart of everything that we do. And as a vendor who's worked with some digital health tools and other things, which I feel could really help in making that shift towards prevention. The thing that we run up against is in-year funding cycles and that kind of short-term thinking when it comes to how are you going to deliver year in cash savings. So I think there's again a call for digital leaders to be brave and to be strong and to be able to take that kind of slightly more long-term view and say, look, we're going to invest now, and that's could be a bit painful, but we can reap the benefits and the rewards in 10 years time. I see a lot of people nodding. I'm also not saying that that's easy, and I'm also not saying that we've necessarily got the right organizational structures and governance set up to enable that, but I think that's got to be the clamour, that's got to be the push that we try and make together.
Fantastic. Thank you, Harry. And Simon, is there anything that you'd like to add before we move on?
Harry mentioned the word money, alluded to it, and it's cash savings. I mean, it's something we're going through now within the NHS, and our trust is no different in terms of SIP savings, so cost improvement, kind of, yeah, those pressures year on year, and the NHS typically works year on year, doesn't it? So if we start then looking at the co-designed and how do we deal with a 10-year plan, having worked within ICBs and then previously actually CCG as well, you should be working across the whole of the system. You should be working across boundaries, geographical boundaries. We probably don't work across the whole of the system. And one thing I'm looking to introduce now within Papworth Hospital is kind of hackathons, workshops, problem solving. And when we go to tender and commission organizations to help us with it, we go and say, we'd like X, this product, this answer. But actually, we kind of need to just we should be involving kind of those organizations to help us solve the problem and understand it, but almost we wrap ourselves up in tight procurement and bureaucracy that we strangle ourselves from enabling to do it and tie our hands too much. And then that freedom for innovation, for the psychological safety that we speak about, and then to actually solve the community problems and that prevention that we have to be driving towards. We don't do, we're not doing. So we have this great 10-year plan strategy, but then do we have the gears, the means, the processes and functions to enable that? And I would say my experience over the last 10 plus years, no. We talk about it, psychological safety, all these great buzzwords, right, let's make it happen. Okay, I've got to go to a subcommittee. Then I've got to go to a steering group with my idea. Then I've got to go to another committee. But I'm done. I'm bored. I've lost the will. I haven't personally, but people do, and then it just stifles it, doesn't it? So it's great ideas, great thoughts in the 10-year plan, but delivering it in reality, bigger challenge, isn't it? And I'm sorry, we don't help ourselves, do we? And there could be changes in government. If we aren't getting political, but we have a change in government and then changes direction again. So it's like, oh my gosh, stop. Anyway, I'll get my soapbox in a minute, John. Quickly go to Penny.
Thanks, Simon. Penny.
I just want to respond to Harry's talk around prevention, but also attaches to funding. And we don't need to start from scratch when it comes to prevention and try to address the impossible, but we can be strategic again. And we know from the data that we have in the NHS where the gaps are, and we can go a bit more targeted. We can make a big impact in those populations that need it the most. Whereas we tend to spend a lot for the people who are already healthy and will remain healthy for the next few years. Why can't we just go targeted? Funding is limited, we know that, but we start with the impossible task. But we need to start more strategic and start narrowing down, given that we have the data to tell us where the problem is.
Great points, Penny. Thank you. Harry, is there anything that you would like to add to that?
Just super quickly, just totally agree. I mean, there's a whole 80-20 rule, right? Where are those 20% of people who are gonna have the worst experience and have the largest healthcare costs and healthcare utilization, and how can we focus our attention on those? And I think with the rise of, I'm going to be the first one to say it, with the rise of AI, sorry, the opportunity to do really smart data analysis and to do really targeted interventions, which at the same time tackle health inequalities. I think we've got an amazing opportunity to do that in the coming years. And again, we have to align our strategy and our execution to enable it. But I think there's an enormous opportunity there. So yeah, really liked Penny's point.
Fantastic. Thank you, Harry. And Carl, thank you for your post in the chat. Keen to talk about digital smart buildings, and maybe in the next 5-10 minutes we'll get onto that question. Before we do, I'm keen to talk about people in terms of attracting and retaining talent, and attracting and retaining skills, and what skills might be needed going forward in line with the 10-year plan, and how you're approaching that in a competitive market. So Kath, could I start with you, please, in terms of like, how do you attract and retain talent in your teams?
So I think this is probably the biggest challenge for all of us on this screen, and probably lots of the people on this call, that we know, and we're restrained by obviously pay scales in the NHS and the comparability to industry and to other options to people. And I'm sure with lots of other things that come with that, with hybrid and flexible working and remote working and all of those types of things, that I think we're getting there in the NHS, but we're probably still, a way behind other places in how we think about that. So I think we have to think creatively outside of the kind of financial envelope, if I'm honest, in terms of recruiting and retaining staff. So it's how we really promote, and I saw someone had put it in the chat, really, it's how we really promote digital leadership in the NHS, and how we make sure that there is clear career progression. It's great there's more people going on to boards, but we need more along that route so that people know that they've got that career ladder and what that means, but also really helping people with those other transferable skills and understanding, so that when they are going into those leadership roles, because the digital role is much more than the technical piece. It's actually what does that mean to our operational colleagues in managing performance? How do you look at patient safety data? How do you do all of that triangulation and understand all of those other elements? So it's giving people some wider experience as well. And I suppose I come at this slightly differently from having done, sounds terrible, many jobs in the NHS in different fields. But I think you need all of that background and wealth of experience. So it's about giving people exposure and showing them actually what else that they can do, and giving people other kind of avenues outside of a traditional kind of digital type remit, in order to give them those skills, but also help them progress up the career ladder. And making sure that we show that investment, so that investment in personal development, that investment in time, that investment in study, or even just that investment to, you know, sit in a committee meeting and understand what the discussion is. All of those things that, you know, again, we just need to make sure that we're doing with our teams that give them something that they're actually working towards.
Fantastic. Thank you, Kath. Simon, could I come to you? Same question in terms of attracting and retaining talent. How are you approaching that at the Royal Papworth?
Topical, quite poignant at the moment. Aside of everything that Kath has just said, banding is a real struggle. So if you look at software developers, their market scale is far higher than kind of the banding permits within the NHS. So how do you overcome that? Haven't solved it yet, if I'm honest. Still working through it. But one of the ways that sits in my mind that we could do is, if there are companies out there, tech companies, and we have people, we know that's one of the reasons I kind of left that world to come into the NHS, is because there's a personal drive to use my kind of digital knowledge and expertise to help other people with health and care and their health, to do something better. It's a bit of a kind of social good. But there'll be other people out there who may not want to leave the private sector and the fair salary they're kind of getting that we can't compete with. So how can we think differently, which is what Kath was saying? And right, could we partner with an organisation, a consultancy or a tech company to say, right, can we have a staff member 2 or 3 days a week over a period of 6 months, and we want to solve these problems? We want to create our own new in-house piece of tech or something to innovate. That's the way you can then bring staff into the NHS and new kind of people within the NHS. Some may stay, some may not, and they may continue. But what they can also do is share their knowledge and expertise with others who are already within the NHS and are happy to stay in it, to upskill and develop. So I think whilst it's great that the opportunities and training is there and there are apprenticeships and other forms, but even that's quite restricted because it doesn't open up to the training and the development that is in there outside of the NHS world. Having worked in both, I've seen that. So that's one way I would address it. I also just think, again, we tie ourselves with just, say, recruiting through NHS jobs, through our own website. And I can tell you, most of the people I know out of NHS world don't even look at those places if they want to gain a new job or new employment. So they would never come here. So we're missing out on them. Yet we don't help ourselves in that respect. So I think there's some really quick and easy wins we can do. But I think, we just need to open up ourselves a lot more to working with others outside of NHS world. And we're driven, a lot of us working in this world are driven by kind of what sits in here, our heart, as the driver and motivation for a delivering change, transformation. Others are out there, so we need to just tap into that and say that there's an opportunity, you can be part of it. How can we then work to help get you part of that? And actually stop flipping it around where we're telling them, ask them. It's co-designing, isn't it? It's that user experience again. So we just need to, evolve our way of approaching. And as digital leaders, we need to be flipping that around a lot more, in my opinion.
Great points. Thanks, Simon. Penny, is there anything that you would like to add to that?
I will be a bit contentious if that's all right, but I think the digital leaders of today, they've got really diverse skills. Okay, they're quite entrepreneurial. Sometimes they're hybrid clinicians or operational staff working between the private and the public sector. So they've got skills that are transferable to both sectors. But I guess sometimes what we are not giving people, and they're not staying in the NHS, is the right incentives. The private sector gives bonuses, for example, bonuses for extra work, bringing outcomes. It's an outcome-based, incentive and payment. We don't do that in the NHS, but we expect the outcomes over and above. So, that's something that basically, if we do it well and we get the right outcomes and the right financial benefits from the innovation and technologies, I think people who go above and beyond should be also awarded. And I don't know whether that is ever going to happen, but we need to think about really, really hard how we're going to keep that workforce if we want to be the digital NHS of the future.
Very interesting point, Penny. Thank you. Harry, would you like to come in?
Yeah, so I agree, I think, with pretty much everything that's just being said. But there's maybe one bit which I wanted to focus in on, which was, I think, going back to my first point around servant leadership, I think that plays a really important role. Like, people will put up with a lot, but it's that if they're hitting into blockers, if they're hitting into bureaucracy, if they're hitting into red tape, and having worked with a lot of developers, there's nothing they hate more than developing a really great feature and then they don't see it released for the next 12 months because it's going through a series of approvals and that sort of thing. So I think the role of the leader in that setting is really interesting. If you have a laser focus on removing those frustrations, removing those blockers and facilitating that good work, I think you can greatly increase people's satisfaction. And then I think the other point which I wanted to make was in and around flexibility. From the outside, it looks like sometimes people can get a little bit pigeonholed and a little bit, clear boundaries defined around their role. So the one thing that we try and support is people becoming more T-shaped, if you want to call it that. But yeah, you've got your core competency, but do you want to go and pick up some more skills in business analysis or architecture or whatever it is? And often if people feel like they're learning, they feel like they're developing that kind of range of skills, I think that's really important. And then also the flexibility where possible to try and gravitate towards projects which they're really passionate about. If someone's really invested in the outcome or something and they really are committed to it, again, I think that greatly increases people's satisfaction. So I think there's a really interesting role there for a digital leader to remove blockers, support people's kind of wider skills development, and then try and get that kind of flexibility so people can pick and choose what they work on.
Great points. Thanks, Harry. I've got two more questions, and then we'll go to some questions in the chat. The first question is about what advice would you give to aspiring digital leaders entering the NHS? Just keen to hear from your learnings or experience. Just what advice would you give to them? Simon, could I start with you first for that one, please?
Two things. One, be aware of big boulders, big buildings moving. Moving those big kind of entrenched ways, processes, etc., is a challenge. So be aware of that. They're also got to be mindful. You've got to be open to life outside of the NHS, to digital life. Harry's kind of living it and breathing both sides of it. I just think that opens up so much. And I think following someone like Rory Sutherland, who's outside of, he's works in the creative ad world, really just sees things differently and he's open to unseen opportunities. So maybe just coming with a fresh face and viewing a digital world as an inspiring leader, like a UFO coming in and saying, right, what is going on down here? How can we address it? Just be open-minded.
You got that in well, Simon. Thank you. Kath, same question to you. What advice would you give to an aspiring digital leader?
So I think a couple of things for me is find a good mentor, and that doesn't need to be someone in digital. I think it's about navigating, life in the NHS, if I'm perfectly honest, not necessarily digital, because it's all those things, like Simon's spoken about with bureaucracy and jumping through hoops, and that's not unique to a digital world, but it's finding someone to help you kind of navigate those. And I think picking up on Harry's point, seek out those opportunities and that other experience, and don't think kind of linear in terms of this just being digital, but think, about that being wider transferable skills and what is it that's going to kind of help you. One, either to think about other opportunities in the future or to think about, what you want to do within roles as well, to give you things, that kind of set you apart from other people doing those jobs.
Great. Thanks, Kath. I've got a quick question for the audience. Keen to hear what skills and capabilities that you think that define a great digital leader. So if you think about your leadership team, what makes them great? What are those skills and capabilities? Like, if you could share that in the chat, I'd be really keen to hear from you. My next question, Penny, could I come to you around what advice would you give to aspiring digital leaders? But also, what skills do you think digital leaders will need in 2035 and 10 years from now that they might not have today?
Absolutely. So I would say it's a very exciting space. It's the future, and because it is the future, and healthcare will depend on digital, it does at the moment. We need strong leadership, and I think we all know that people sometimes end up in digital leadership roles by default, and they haven't chosen it. They have not been trained. And as Catherine and Simon said, people need to have general leadership skills. So the exposure is really important to NHS structure, to governance structures, to different roles within the NHS, and get that perspective even in different areas. Okay, not limiting yourself into one particular organization. I think that is key, and that creates flexible, agile leaders who have had the experience across different regions. They work with different leaders and they create their own, I guess, strong status. I would say that would be my number one. The leaders, the skills for the future is obviously training in digital and tech and AI, but we know that the majority of that work is about change and it's about leading people.
Great points. Thank you, Penny. Simon.
Yeah, something Penny said it again, just talking about digital leadership and being kind of at the top and having its real kind of own role and focus. It popped into my mind that there was a role I remember seeing some time ago about somebody's in it, was on LinkedIn. They've got a digital function within them, but they're also chief finance officer in digital, and just sat me. Doesn't that go against saying finance typically risk averse? So it's not, again, quite generalizing, but it's almost an oxymoron that you've got somebody with finance then having to innovate in digital. And if we as the NHS moving forward the next 10 years and with the 10-year plan have got to move towards greater use of digital, yet if we're hampering with finance, so Harry mentioned it earlier, I think it was Harry, yeah, how do we deal with that? We need to find a way of overcoming that. Otherwise, next 10 years, the skills we'll need, I think we just need to make digital its own entity as well as embedding it throughout. Unless we do that as a whole NHS system, we're just going to trip over ourselves and just not deliver. And what potentially worries me is that the NHS we have now, it's a fear of what's it going to be in the next 10 years. And will it actually be usurped by another entity that actually doesn't constrain and restrict itself in the way we are? So 10 years time, NHS digital leaders and skills could be vastly different, I fear.
Thanks, Simon. Kath, would you like to come in?
Yeah, so I think there's definitely something about how we build that digital professional and what that looks like and what the structure is. And I know we're still waiting on sort of the digital workforce strategy and things to come out and what that might tell us. But I think we need to be really key in influencing what that looks like and what that means for us as digital leaders going forward and what we might then need to do in relation to that. But I think the other bit that we also need to start playing a much bigger part in is that political influence and that national influence and getting some of these things, on the agenda. But, as Simon referred to earlier, we'll get a plan, but actually then the delivery of that plan and how we deliver that plan and what that looks like tends to then be very much up to us almost in a way as individuals to do that. I think we need to get much better in our political influencing skills as to how things are managed that are given to us as things that we need to achieve without that sort of framework to do so.
Thank you, Kath. Harry?
Yeah, I was just going to go back slightly in the conversation in terms of the sort of advice for new digital leaders, and got two thoughts on it really. I think the first one, having been through something of that transition from a clinical role into digital myself, I think the most important characteristic to really try and develop is just relentless curiosity. Right? Just become an experience sponge, go and speak to people on the front line, understand what's going on there, start to get a basic understanding. You don't need to become the world's best coder, but start to get a bit of understanding of all the various different tech and how it works, and enough that you can actually speak the language of the developers and others who are then going to go and learn the basics of Agile and that sort of thing. So that relentless curiosity and just constantly asking questions, constantly trying to hone your skills. And then the other point I wanted to make was more skills needed in the future. And I think it actually ties back nicely to what we were talking about earlier in the conversation, that increasingly tech is becoming the easy part. And I think over the next 5 to 10 years, we've already seen vibe coding platforms and other things which can spit out apps. They're just going to get better and better. Increasingly, they actually building the software is going to be the easy bit. So where the focus of future digital leaders needs to be more is making sure they're representing and being an advocate for the end users and really understanding the clinical problems. And perhaps finally, being able to elevate your thinking from, instead of being very focused on your specific bit of a process, start to develop that systems thinking. So you can start to understand end to end what's going on through the system and how you optimize the whole thing rather than doing a point optimization. So I think there's going to be a shift from, really being good at developing tech to actually those more human parts in the future.
Great points. Thanks, Harry. Going to go to a question in the chat. Simon, can I come to you on this one? It's about smart buildings and whether there's been any discussions about digital smart buildings. So I want to come to you for that question, please.
Gosh, it's constant. When you work at Papworth, it's wonderful, but there's so many different ideas, and he so wants to lead on digital kind of excellence in so many different ways. So smart buildings, it's not really kicked off enough of a discussion. AI hasn't, smart buildings haven't. I was having a chat with somebody at NHSE in terms of cloud strategy and everything around that front. And then you have the discussion, well, that's cloud, so that's revenue, that's not capital finance. Sorry, we only have capital budget to help support it. The trust doesn't have the revenue budget, can't do it. So there's so much we should be doing with digital smart buildings. We're talking about RFIDs as well, kind of connecting when you've got devices or patients who are walking in and out of wards. We should be tracking all of that and knowing what's going on. Even the wristbands that people have, we kind of tracking it and know what's going on. We're not embracing it. We don't understand it. We're not having enough of a discussion about it at a system-wide, NHS-wide. And I don't think we know how to. There's little pockets being discussed. So, yeah. It's one of those we just need to smash, and we haven't even got into data and analytics in this discussion. I've seen something in the chat. We are SDE, FDP, that world. How do we use the data? We're still not there as well, are we? But unless we tackle it, whether it's the digital kind of smart buildings, or the devices that we can use, or the tech, yeah, it's going to be a problem. And I wonder that our challenge is waiting for it to be top down. I think we need to just start within our own kind of entities, maybe bottom up, and just start doing it ourselves now. And that will unearth how we drive it forward to then inform central and upwards.
Great point. Thanks, Simon. Can we quickly end on a key takeaway? We've only got 2 minutes, so it's a bit tight to squeeze this in, but I'd love to hear one key takeaway from each of you, please, if that's possible. Penny, could I start with you, please? What's your key takeaway from the discussion today?
For me, is if we are going to move forward positively with digital leadership, we should support the growth and development of leaders, and they need to be more involved strategically and have a strategic saying in, what needs to be done and what doesn't need to be done. And I think we need to be brave about saying no as well, so that we can focus on the things that matter.
Fantastic point. Thanks, Penny. Kath, could I come to you?
I was going to say about strategy, but I'll go with something else. So I think for me, it's remembering that actually we're very good at trying to jump straight to a solution. I think it's about being clear about problem solving and using all of your leadership skills in that problem solving to get to a really clear point of what is it that I'm trying to fix and what might my options be in doing that. So using all of your leadership skills in terms of change, in terms of communication, negotiation, conflict resolution, all those things that come into, you know, that part of the process to make sure that what you're doing is the right solution rather than just jumping to a solution.
Fantastic. Thanks, Kath. Harry, anything that you'd like to add?
Yeah, super quickly, I think Penny touched on it already, but be brave, be courageous. I think that's what we're really calling out for. There's a lot of challenges, but there's also a lot of opportunity. So if we've got good digital leaders in place, I think we can capitalize on that.
Great point. Thank you. And Simon?
Key takeaway for me is we've spoken about digital leaders being those maybe in sort of chief officer roles, etc. But actually what's mentioned, since picked up what Kath said and in the chat, digital champions. So if you've got somebody within your team who may be an expert in, say, data or AI, whatever it may be, they themselves should and can be the digital leader in it because they have the expertise and knowledge. And because they have that, they can build up that trust, integrity, and credibility. So actually, digital leaders isn't just those that sit at the top of that hierarchy. They can be anywhere, at whatever kind of role and function within an organization and team. And we should actually give them the opportunity and platform to be that leader for us and others. That's my key learning.
Completely agree. Nice point to end on as well. Conscious of time, so I'm going to quickly wrap up. Thank you to the panel for joining us. It's been fantastic today. I've really enjoyed the discussion. I hope everybody in the audience has as well. There will be a write-up and recording shared shortly. It's 1 minute past 11, so I'll have to close here. But thanks again to the panel. Really appreciate you taking the time to join us. And we hope everyone can join us on the next webinar. So have a nice day, everybody. And thanks again. Cheers,
Cheers,
all.
John. Cheers,
Thank
all.
you.
Bye.
Bye.
Thanks. Bye.